everybody. My name is Dr. Donna Reece, and with me now is Dr. Arleigh McCurdy. Dr. McCurdy will present abstract number 724, which describes iberdomide, one of the new cell mods, in combination with other agents in relapsed refractory myeloma.
Thanks, Donna. So this study was designed to look at the maximum tolerated dose and recommended phase 2 dose of 2 combinations using the backbone of iberdomide. So one group had the combination of iberdomide, bortézomib, and dexaméthasone, and the second group had the combination of iberdomide, daratumumab, and dexaméthasone. I think it's really important to note here that this was a very heavily pretreated patient population. So the combination group with iberdomide, bortézomib, and dexaméthasone had a median of 6 prior lines of therapy, and the combination of iberdomide, daratumumab, and dexaméthasone had a median of 4 prior lines of therapy. And many of the patients included in this study were refractory to all of our conventional treatments, including proteasome inhibitors, immunomodulatory drugs, and monoclonal anti-CD38 antibodies.
What stood out to you the most from this presentation?
I think most impressive was the response rates in this heavily pretreated population. And so the overall response rate of the combination iberdomide, dexaméthasone, and bortézomib was 60%, which is better than would be expected in this group. And the combination with iberdomide, daratumumab, and dexaméthasone was 40%. And so it's early days to know how long these remissions will last in these patients, but the activity of the combinations is certainly very encouraging.
For the practicing Canadian hematologist, what do you think the potential impact of these findings might be?
So I think this is very exciting for Canadian hematologists and patients for a couple of reasons. First is to have another exciting cell mod being introduced to our patients with good activity in combinations that seems to be well tolerated so far. The second actually is that, as you know, we're designing a research study right now through the CMRG to evaluate the combination of iberdomide with bortézomib and dexaméthasone for newly diagnosed patients who are ineligible for transplant. And so I think that will afford an excellent opportunity for these patients to have access to this combination in Canada and provide meaningful data for the global myeloma community with respect to how to introduce and use this combination.
I think one of the key points of our future trial will be to study weekly bortézomib in this 3-drug combination, which we have found in our own country's experience to decrease the neurotoxicity that may be seen with twice-weekly bortézomib administration. Thank you, Arleigh.
Thanks.